Hello, everyone. Well, today we're going to talk about what lameness issues we are all missing in sport horses. I mean, that's everybody. What are we all missing in sport horses? Because I feel like we're getting there. We're starting to progress. We're on a cusp of teeter-totter that I feel, don't you? Dr. Kate Workman is with me again. If you guys are watching on YouTube, you can see us both in live. I'm in my office. She's in her office. We are all missing so many things, right, Kate? I mean, I find that this is a discussion. You look at the AEP, like AEP is coming up in December, right? And we should be talking about so many other things at AEP, but sometimes the same people, the same topics are just repeat, rewind. Like you have people that are non-clinical, like completely non-clinical, presenting facts that have been around they've been talking about the same thing. So it's a rewind, repeat. And I feel like even myself, like I miss things all the time, right? You miss things all the time. But as a general, like what are we all missing? Because you as a rider, you as a listener, trainer, veterinarian, we all need to figure out how we can help these horses more. And that's been my whole goal this whole time with doing podcasts, is to kind of download what I have here from experience, seeing horses and figuring things out and putting it out there to help more people with their horses. So that's what the podcast is going to be on. We're just going to jump into it. And the first thing I always do whenever I think of a topic, and you can ask Kate, I'm always off the cuffs. And Kate, I like do things come to me and I'm just like, okay, this is what we're doing. And it's sometimes last minute. I don't really have to prepare much like for a podcast like this, but the first thing I always do is I go to Google, right? We as veterinarians, we like hate Google, like, yeah, anyways. In this situation, it's kind of good. So I went to Google and I typed in, what is the most common cause of lameness in horses?
Let me guess, because I didn't do this. Navicular disease.
Well, there wasn't a hierarchy or list. Okay.
Oh,
I can tell you what the list is. Okay. It's the common causes of lameness. This is what came up: abscess, tendon ligament injuries, OA, osteoarthritis, laminitis, navicular syndrome, sacroiliac joint disease, OCDs. I'm pretty proud of Google for this because yours was fifth. The number one thing, and the first thing that comes up, just Google it. What is the most common cause of lameness in horses? And it is pain, which it's pretty impressive, right? Like, and it says pain is the most common cause of lameness in all horses. When unaccompanied by pain, the lameness may be mechanical. I'm like, yay. People are actually thinking, like Googling stuff, right? And the more you Google, the more words you put in, the more they come up with this stuff. It's algorithms. And AI is helping so much with this too. People don't realize, but AI is behind so much of this, how people write papers anymore, or people come up with things. It says it is important to correctly determine the cause of lameness because treatment varies greatly depending on the cause. And so I go, okay, what are the most common causes of lameness? I put that in. And it also says inciting factors in lameness include direct or indirect trauma, fatigue, resulting in incoordination of muscles, which often occurs in racehorses at the end of the race, which is what we call in the thoroughbred industry run fatigue, okay? Inflammation, infection, and failure to recognize early warning signs of pain, reduced training times, resistant lead changes. This is what they have. They also say soft tissue strains and tears resulting in lameness are all too common. Once veterinarians frequently diagnose in hind ends include tendonitis, suspensory ligament injuries, and degenerative suspensory ligament desmitis. That was it, plus the list that I read to you of abscess on down. So pain, to me, the fact that people are recognizing that these horses are in pain. And I give credit to Sue Dyson for this, right? Don't you? I mean, with her writing Ethogram, I think that we as a profession, it goes back to the paper from CSU with the, what is that?
Dangerous horses.
I threw that thing across my office.
Yeah, the dangerous and behavioral horses.
Yeah.
Right? That's what it's called.
Yeah, I literally have marked that paper up more and thrown it. I do throw them, people. Like, I literally throw them across my office. I just go, because I have to stop reading it because it frustrates me so much. But nobody is talking about really body lameness. They're talking about back pain, but and pelvic pain, but nobody is really talking about body lameness or limb lameness versus body lameness. But I also think, and you and I agree, and you've come this far with me, is the fact that people are not aware of this. People, once you make people aware of something, they have the choice to be aware of it. I always think of it as like a marriage, right? You do, you and I can talk about this. Kate, Kate is so funny. I'm so particular and so like packing everything. And I'm a minimalist, so I can pack it for a week in a small teeny weeny.
I do not.
Kate does not. She carries this 10, well, no, it's about 30-pound big luggage thing for like 4 days at AEP.
I think I had two. Like I show because we both flew in and got picked up at the airport, but we like flew in separately because we live separate. And like you stroll over with your little carry-on that's like, you know, this big. And you're like, what do you have? And I'm like, because I have a full checked bag, like a full suitcase. And then I have my carry-on. And at the time I was still breastfeeding. So then I have this giant Yeti backpack cooler that's going to store all this frozen breast milk to take home. And you were like, have you brought? And you had this full pack. I'm like, oh. And then it was good too, because like, right, you go into your bedroom, because we all stayed in Airbnb, there's a bunch of us, and you like put away your clothes and they're in a drawer, and you came into mine and you were like, oh my God, I can't even be in here because I just have
it's like a bomb. It's like a bomb went off and I'm like, oh my God, how do you find anything? Right? It's just anyways.
How you were physically ill by walking into my room because the chaos like was enough to just, you know, send you over an edge.
I was. But anyways, it goes back to that thing that like if you're in a marriage or boyfriend, girlfriend, spouse, whatever, and you do things that may annoy the crap out of them, right? You know, her husband is the same way. Like her husband, Mike, and I are totally the same. It's so funny. So it's kind of that if you're not aware that something annoys the living daylights out of somebody else, you don't recognize it. Like you totally don't recognize it until they say, hey man, can you stop like doing that? So you make them aware, like you're like, this drives me crazy. Once you make them aware, then they have that choice, right? They have that choice to say, I'm going to honor the person I love and not throw my stuff everywhere. Or if I do, I'm going to close my closet door so nobody can see it, right? Yeah. But it is that factor, I think, that once you make people aware of something, they have to choose. Are they going to change? Are they going to be aware of it and do something about it? And I think that's what I've come to in my years of experience as a veterinarian is I have tried to help so many people. Like, and you know, I don't charge veterinarians. I don't charge them a dime. I pay, they don't pay for the drugs. They don't pay for anything, right? Like that's my ethics and principles to help our profession. I don't expect all veterinarians to do that. That's just what I do. And that's my personal choice. But which just let you know, veterinarians, when we start doing the research and stuff, I'm going to call people, I'm going to call in these favors, because every time I treat a horse, like, it costs me a lot of money, like $700-800 of my own money. So all you veterinarians out there listening that I've treated your horse, you think about how many times I've helped you and how much money it costs me out of my own pocket. So I'm going to call in some favors. I think I deserve that, don't you? But anyways, I think our profession is aware of things. It's just that they maybe don't want to change, or the fear of change. I find that's why we're missing things.
I think it goes back to anything you consider normal in your life, right? So that it's whatever your mind gets trained to in habitual patterns and normal, that your mind just overlooks it because it doesn't red flag as a clinically relevant impact. So you go to two scenarios. You either have somebody that never saw a horse that like has that like kind of wobble to their walk, right? So the neck does,
or the
this,
chicken peck to their
or
walk.
the chicken peck to their walk. With every stride, they're like, right? You start to see some slight differences in things, or a toe drag, or a double toe tick, or I mean, the list could be never ending of the signs that you should pay attention to. But if you've either never seen it, it's not that you haven't seen it, you see it all the time. All the time, everybody is seeing this. It's whether you're recognizing it. Some people never recognize it. Other people recognized it, but never had something to pair it to. So they just were like, oh, well, that's either just how they move, or I've always wondered. How you get vets that are like, I've always wondered what that was, but I didn't know what to pair it with, right? So like a hock pain movement has a very distinctive pattern. We've kind of all memorized that pattern. Any reasonable sports medicine vet can watch a horse jog and be like, oh, that's hock pain. Any reasonable horse trainer could also tell you that. It's not a hidden secret what that looks like. So that is there. But in body lameness, it's whether they even see it and whether they recognize it. And you or I could train anybody, owner, veterinarian, professional rider, to, if they can see it, we can give them a pattern of recognition for it. If they can't see it, it's really hard. It's like feel. If you don't have it, it's very hard to cultivate that. But even owners, like, my owners, particularly show clients of mine or whatever, once you open this Pandora's box, they're like, oh no, I can never go to a horse show. I have a lot of clients that are judges, and they're like, now I have to sit at a judge and I want to put lame, 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 da, 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 da. They want to write all these notes. Of course they can't. And they're like, every single horse had a problem. And I'm like, and they're like, well, now what do I do? I'm like, oh, you got to judge the ring in front of you. And all movement patterns don't necessarily mean pain, or they don't necessarily mean the horse is not functional, but they are notes to the picture. So,
of what's wrong, right? That we
because they
missing.
all do it. And so all of our eyes get blind to it. Every single Western horse is dragging its hind toes. 99% of them. So nobody goes, oh, that's not normal, because they all do it. But doesn't mean it's normal.
That's why people don't like showing Western horses on Ural footing.
Correct. Because they hate going to that footing.
Yes, because I mean, they're used to being able to drag and not have to pick up their legs, because sand moves, dirt moves, right? And then you go to a Ural type footing that's kind of sticky, which is good for jumping, but it doesn't have give. And so they're like, we hate showing.
Hate this footing.
Yeah. Well, if your horses picked up their legs, then we wouldn't have these problems. But it's legit. It's a legit thing. I mean, you don't want to show a cutter or reiner in that footing, because they can't show in it. I mean, they have to have deep, soft, giving footing. But it's like you say, it's all these things that I think you do get blind to. And for me, I get blind to things too. I had literally just saw a horse yesterday that the one stifle, the left stifle, was always swollen, right? And it had been worked up literally by 12 vets, including two universities. And I treated the back and pelvis on this horse because it drug its left hind leg and could not bring it forward. Well, it got better after I treated the back and pelvis, but the stifle was still full. And I'm like, this thing's got to get checked out. Yeah, it's been, x-rayed, ultrasounded, all the flex blocked, all this stuff for literally for 3 years. And I was like, this has got to get checked out. So I sent it to the trainer. I told the trainer to take it to somebody else. Well, they found fragments in it. The horse had surgery. It had like not OCD, but literally fragments in the stifle. And I think it's not ever easy sometimes we're all missing things, right? I miss that because I don't do limb things. I mean, I know the stifle's swollen for a reason. And that's why I just go, you got to have somebody else check this out again. So it's bringing in other people, but I think we all get blind to things. And
yeah, because you're going to miss things you don't see. And if you don't recognize patterns that are leading to body lameness, right? They're going to recognize limb lameness patterns because they limp, they have short strides, they do all the things, they flex, blah, blah. Body lameness patterns are totally unrecognized by a bulk of people, not just veterinarians, but people in general. And so if you don't recognize the lameness or pain pattern, you can't diagnose it.
Right. Like what you said about, remember when I first showed you when we had that horse that would like waddle its neck as it was trotting? It just, I mean, I have this beautiful video of this really great reining horse I was riding. And every time I tried it, its neck was like, whoo. Is a big, beautiful Palomino. And I'm like, and this is when I was starting to figuring out like really what was going on. I'm like, that is so wrong. Like, why can't he? And I'm like watching the scapula. I'm like, oh, every time this scapula goes back, his neck goes, so you figure it out that way. But it's also like the chicken peck thing. When a horse walks like this or trots like this, you're like, okay, that's really messed up. Or they throw their neck out to the one side on the circle, but they don't throw it out the other way. Or twist their neck. Or if they do it both directions, it's horrible. Yeah. Horrible. Yeah. Right. I'm like, oh God, those cases. Like when I see a horse do that, when they throw their neck out of the circle when we're lunging them both directions, I'm like, oh, this is really bad. But it goes back to the same thing.
Horses that have a slight hop, right, in the upward transitions, they can't have a clear transition. They go up into it. Yeah. I saw one the other day that like could jog. It was a little ranch for a stilly horse, and it could jog. But if you asked it to trot, it just cantered. Right, there was no ability. Sound jogging. The second you ask those shoulders to actually open and separate, it just would pop into a canter. That's not a limb problem.
No, it's an axial skeleton problem.
It's not like a horse, because a horse in a field can, especially a Western horse, jogs and they can go and trot off. So if they can't do that, there's something wrong there. So that gives you more reasons, but you have to pay attention to those things.
Yeah, I think it's all these things that we are missing when, like you say, everybody's seeing the same thing. But it's, for me, the goal is, to me, diagnosing which section of the horse is affected. And most of the time it's all three sections. If you guys don't understand the sections, you can go back to a podcast that I did, I don't know how many years ago, like 5-6 years ago, about sections. To me, the sections of the horse, once you diagnose those sections, then it becomes so much easier to figure out what you're really dealing with, right? I mean, until I figured that out as a veterinarian, I was kind of jumping around thinking, trying to figure out the puzzle, but it is recognizing the patterns of dysfunction that I think in the biomechanics of the horse, right? Like what you said about the Western horses, every single one of them toe drags. It's very common. Or a horse that we know has a shoulder girdle issue. We can see that as soon as you start walking or trotting or cantering, especially, they develop this real narrow scissor-like movement of their front legs, where you don't see it at a trot, but when they biomechanically have to use both front limbs independently in the canter gait, then it shows up like markedly. You're like, oh, I can't look at this anymore. The good news is, as we're talking about this, and I literally just did this last night. I was going through my desk and I was going through all my magazines and I came upon the fall issue of The Horse. And the title is Top Line Troubles, Back, SI, and Pelvic Pain. I can't believe they put the word pelvis. I know.
Right. I'm not sure where your SI is if it's not in your back or your pelvis. So this will be interesting. But
the best part is Sue is actually quoted in this. So Sue Dyson, I have, as you know, Kate, I adore Sue Dyson, and Sue and I communicate, and she is an amazing veterinarian. She has brought our profession. I personally believe she has advanced our profession, and still trying to advance our profession. The writing ethogram is a game changer that has changed not only social licensing, what we tolerate as people, as spectators watching horses compete. She has been on the cusp of changing that because she is so dedicated. She's dedicated her whole life to this. And I have utmost respect to her. And she's passionate about it too, just like I am. So I got to read some of this to you. And it's interesting. It says, top line troubles, a multitude of issues can affect your horse's back, sacroiliac joint, and pelvis. So they talk about back and hind limb lameness are leading causes of poor performance in ridden horses. In one study, researchers found that 74% of horses with back problems were also lame. And the back problems were concurrently diagnosed in 32% of lame horses they evaluated. The authors concluded there was a strong association between equine lameness and back dysfunction in horses. These stats might not surprise you. In fact, they might sound all too familiar if you work diligently with your veterinarian to resolve hock or stifle issues, only to find your horse's back persistently sore. So they go on to talk about, and they talk about the pelvis. The pelvis consists of three bones, the ilium, ischium, and pubis, and contains several important articulations, namely the sacroiliac, SI, where the sacrum and the ilium, the largest fan-shaped bone of the pelvis, unite, and the bilateral coxofemoral joints. Large, powerful muscles and their associate tendons.
You're missing a really big one.
I know. Anyways, let me read. Large, powerful muscles and their associated tendons, including the gluteal and hamstring muscles groups, as well as the iliopsoas muscle, originated deep within the pelvis. Move the bony structures of the pelvis. Can you believe they said iliopsoas?
I'm going to give them a +5 for that. They're missing the one joint that the iliopsoas actually moves.
Wait, but I'll tell you who brings it up, okay? When thinking about the pelvic anatomy and biomechanics, remember 2 points, says Sue Dyson. And she goes on to talk about her experience and everything. Then there's this thing. The SI joint is unlike other joints. While most synovial joints in the body articulate 2 bones to allow movement, the SI joint's job is to restrict motion and stabilize bones. Okay, let me read that sentence again.
Read it again, louder for the people in the back.
Yeah, for all you veterinarians out there and listeners, listen to this. While most synovial joints in the body articulate 2 bones to allow movement, which means synovial joints are like the stifle and the femur connecting, right? That's a big joint, okay? The SI's job is to restrict motion and stabilize bones. The 5 sacral vertebrae are fused together and allowing only minimal flexion. Very little flexion. If that thing is moving, we are in big trouble. And that's not it. The SI's motion is further restricted by the stabilizing effect of 3 sets of ligaments. I think people have been educated by me, by the way, says Robin Bell. He has this long list of letters, 4, 8, 12, 16, 17, 18 letters behind his name. Okay, and we have 3. Clinical professor of the equine sports medicine of the University of Florida's Equine Hospital at the World Equestrian Center here in Ocala. He points to studies in which researchers have shown this joint only has a 1 to 3% range of movement in the horse. 1 to 3% movement. As a low motion joint, the SI sits within a fibrous joint capsule rather than the typical synovial type found in leg joints such as the fetlock. A fibrous joint capsule primarily consists of relatively immobile, dense, tough connective tissue. As Kate and I can tell you, if you want to, when we do necropsies, when you want to get through those thick, fibrous connective tissue ligaments, right? You have to get not only a big scalpel blade, but a very new and sharp scalpel blade, right, Kate?
Yeah, it's so funny. We did necropsies last week. And we had a lady come and help us because we were short-staffed and she was friends of somebody. So that's not a PR that we take people. We don't. But we had a new lady with us those days. And she must have had some amazing fascination with the SI because that's what everybody talks about. So we had finished kind of the bulk of the necropsy. We were focusing on the horse's neck and thoracic region. So we were just kind of debulking. I did. And she kept going, is that the SI? Is that the SI? Have you cut through the SI yet? And I said, not yet. I must have said not yet. It was like a kid in a car ride, you know, when they ask if we've gotten there, if we gotten there, if we gotten there. I'm like, not there yet. We're not there yet. So we take it apart. So you have the whole box of the pelvis with the sacrum fused in it.
Yeah.
Because the SI, even when you remove all the muscles that also contribute to stabilization, it is very well in place.
You can't move that thing.
So at the end, I'm like, watch, see? And I take the whole box of the pelvis and I go, oh, okay. I said, no, that is your lumbosacral. Disarticulate from lumbosacral back. And so I just have pelvis and sacrum together. And I said, oh, there it is. It's just like all of those ligaments were taken apart by this point. Thigh is still intact. Like, oh, it's like it had clicked that a bunch of videos of it. I'll try and organize them, and that would be a great thing to put on our Patreon page for Rexos because I don't think until you actually see it,
yes,
box that does not move.
It doesn't move, and it's so hard to take it apart, right? People, right? And that's the thing is, so I'm reading this last night, right? Of course, I'm like, oh, this is perfect for the podcast tomorrow. So let me go on. So it says, as a low motion joint, the SI sits within the fibrous joint capsule rather than the typical synovial type in leg joints such as the fetlock. A fibrous joint capsule primarily consisting of relatively immobile, dense, tough connective tissue. It serves to offer structural support and limit excessive motion between adjacent bones, sorry. Another interesting characteristic of the SI joint is that its different surfaces contain different types of cartilage, Bells adds. The sacral surface is made up of hyaline cartilage, while the iliac surface contains primarily fibrocartilage. Hyaline cartilage is flexible, while fibrocartilage is comparatively rigid, providing structural support. Consider it a trade-off, this sacrifice in the flexibility of the sacrum and the SI joint. The flexibility, there is no flexibility. Provide strength and toughness to the region responsible for carrying a 1,500-pound plus pound animal forward. So then it goes risk factors. In 2010 study, researchers identified discipline, especially show jumpers, with a heavier body weight as primary risk factors for SI pain in horses. The authors found no correlation between conformation and SI pain, but did find a substantial higher proportion of warm bloods, 51%, in the SI pain group compared to the control group, 29%. As for the horse's back, pain causes are numerous and often multifactorial. Compared culprits include saddle fit, rider weight exceeding 20% of the horse's body weight. I read this paragraph only because of this. I think that people, and I'm just going to interject here. I think that we as veterinarians, and I do this all the time and people are not happy with me, when you have a horse and your body weight exceeds that 20% of the rider's weight, there is a problem. Okay, so common culprits, saddle fit issues. I'm so glad they brought it up in this article. That's why I wanted to read this. Body weight exceeding 20% of the horse's body weight, improper horse and rider biomechanics, lack of fitness, and strenuous training. I think strenuous training is also a big culprit. Understanding culprits, it's all connected. Now, this is where Sue comes in. As with the clinical problem that changes the way the horse ambulates, back soreness can be secondary to sacroiliac disease, explains Bell, naming epaxial muscles pain and atrophy as common presentations of back troubles. The epaxial muscles run along and just above the spine, stabilizing it. To offload a sore pelvis, a horse might alter the biomechanics of his back, tensing up different muscles to alleviate the stress endured by the pelvic region. I have a different opinion. Because of these compensatory changes, I believe that it's compensation. He's effectively stressing and overworking his back muscles and ligaments. Over time, this abnormal posture can lead to the back pain, muscle tension, stiffness throughout the horse's entire top line and pelvis, says Bell. Dyson, which is why I'm reading this, Dyson has specifically observed prominence of the lumbosacral spine and concavity between the prominence of the tuber sacrali as long-term posture abnormal secondary to lumbosacroiliac region pain, right? That's the correct terminology, right, Kate? The only thing that we've forgotten in there that Sue forgot was the intertransverse joints. Some horses, this is what she says, some horses who are lame in their hind end develop secondary lumbar epaxial muscles and hypertension. The hind limb lameness may alter the gait and lead to some lumbosacroiliac pain. So they go on talking about kissing spine and all this. And she says, she's talking about likewise blocking the SI joint by infiltration or local anesthetic in research settings has been shown to relieve the pain and discomfort in 98 to 100% of horses with suspected sacroiliac ligament strain and joint arthritic damage. In a 2010, okay, we are in 2024, so 14 years ago, Dyson explained that numbing the SI area with anesthetic restores full movement in horses with SI pain, and this improvement can help veterinarians reach a diagnosis. Otherwise, Bell adds, misdiagnosis or lack of appreciation of primary clinical problems such as SI pain that is causing secondary back pain is one of the reasons that horses with sore backs will have recurrence of back pain even without treatment. Okay, so it's so contradictory, right? They're saying, I mean, this is how they're citing research from 14 years ago. 14 years ago. When they're
in the human world might as well be archaic.
Yes. So the SI, I'm telling you people, the SI, I don't even think it's 1 to 3%, because if that thing is moving, ask anyone that has sacroiliac strain. The ligaments are so tight where your sacrum and your ilium attach. And if there's mobility there, it is extremely painful.
I did mine when we were doing, we were here when we did that. We were doing a knee cropsy. For whatever reason, I was on the floor, which is dumb. I'm too old to sit on the floor. That was the notion, that I was too old to sit on the floor for hours. And I hopped up because I was so excited from whatever we were researching or whatever. And my right side went pop.
Mm-hmm.
Totally disrupted my right SI. I couldn't even stand. I could not walk. It was hard to breathe. It took days of PT to get that sort of back in.
Right. And that's in a human, which is a little bit
correct,
more which is more, the horse is not. No. So it goes, we're missing because there's not enough research. We're citing things that are 14 years ago, and we're talking about things that are not moving. It's kind of like the sacroiliac region and the sacrum. If that thing is moving, like if those things are moving, it's kind of like the transverse. I always go back to cars, right? It's like the suspension on your car. if you have a ball joint go out, or the shocks and springs of your car go out, the ride gets rough, or you hit a huge pothole and now you've ruined the suspension, right? That's kind of like the SI, or you get hit and you bend the frame of the car. That's severe, that's sacroiliac pain. The thing, you don't want to talk about things that don't move. Like, there are problems there, but by the time we see them on rectal ultrasound, by the time we rectally ultrasound them and see no L6 disc and L5 is enlarged, or we see no space in between the inner transverse joints, we're way too late. Like, we're way too late. Kate and I are just trying to educate you guys on why we're missing all these things and why this article is helpful, but it's also misinformation. Sue Dyson has it right. It is lumbosacroiliac region, which includes all the things there, like, right, the facets, the intertransverse joints, the transverse processes, and the lumbosacral joint, which is the most important thing.
I'll disagree with you a hair here. So it doesn't move. We all agree on that. There's changes there. We all agree. By the time bony changes are set in, there's no fixing
ligamentous,
that.
right? Ligamentous,
whatever. I don't think we can ignore a non or low motion joint, right? You can't ignore pastern arthritis just because it doesn't move. It's a legitimate thing. It causes pain. There's cartilage erosion, et cetera, et cetera. However, in the sacroiliac, there can be pain there, but the pain then causes biomechanical dysfunction in other areas. And you have to treat the other areas, right? Mm-hmm. That the ultimate end to is correct. And you don't do a ton of off the track thoroughbreds just because you kind of have a higher patient population than I do. But I treat a fair amount of off the track thoroughbreds. They all have sacroiliac dysfunction because the damage that is done as a 2-year-old racehorse when none of those joints are fully fused through and none of them are stabilized, and the sheer forces that they damage going around. Now, they all have it. It doesn't mean it's actually the clinical problem, and it 100% doesn't mean it's the only thing you can treat. So there is that. You cannot just inject the SI joint, which
right.
We could argue for days. I think it was Sue's paper that talked about the SI joint injections and complications and all of those things, that everybody even does it differently. So you can't even tell that somebody's done the joint because you can't see it. But that pain there absolutely can be real, but that pain there then transfers to everything else, because we're talking about a lumbosacral being right here and the SI being right there. I mean, we're talking maybe centimeters from each other in a big horse. So massive bony remodeling and spurs and changes, especially with a really catastrophic SI, of course, is going to affect your lumbosacral. I can't change the bony changes. What I can change is those high motion joints and their pain.
Right. Because, I mean, I agree with you. I think that, especially I think thoroughbreds racing.
Thoroughbreds are the real big.
Right. And I've talked about this before on other podcasts. It's centrifugal force, right? It's the right hind leg will always tear the micro tears of the sacroiliac, especially the dorsal ligament of it, because of the shear force. But I personally think that the lumbosacral joint becomes dysfunctional not only because of the shear force and the but it alters the biomechanics, because muscle soreness, I mean, I think it's a revolving door, like what you're saying.
It's like it's pulling.
Right. I think
each other, which I think goes back to what are people missing? Well, you're missing a lot because you can't image it all interconnectedly together. Like,
right.
Never just has kissing spines.
No.
Never is a singular problem. But because you can't fully image rib articular facets and you can't fully image all the nerve roots and you can't, like, necks are such a great example of that. We just always thought it was neck arthritis. And now that we do way more neck CTs, we're like, oh, it's actually all of these things.
It's so much more, right?
Navicular disease used to just be about the bone. Now they're like, well, the bone is really the aftermath. It's really all the soft tissue that goes wrong. And by the time you have bony changes, the soft tissue is destroyed. So like,
right. But I think you brought up a good point about the pastern, right? Is like, yeah, that it hurts. And once we fuse it, the pain just like hocks, right? Like the lower joints of the hocks. Like once you fuse them, then once they become fused, then they're not painful. But it's like what led it. I mean, the hocks can be genetic, right? Like certain breeds have horrible hocks. But pastern arthritis, I think, is what started that process, right? In racehorses, we know with sacroiliac, it's from training, from pushing these horses too young. The pastern, arthritis and everything like that is from overloading, from years and years of overloading. I've never seen a horse have a pastern OCD. Has that ever? I haven't seen a published.
I've seen one or two that had pastern OCDs, little cysts in them.
But it's not common,
No, it's
not common.
No.
And that's what I mean. It's like, what caused this, right? We're missing all this, the patterns, like what you said. It's recognizing
navicular disease, great example. Why did all the soft tissue go bad?
Right. So I think that is it, right? Nobody understands the pattern of biomechanics of these performance horses. I've always said it is like a hollow and bulged horse. Like, what created the horse to be hollow on one side and bulged on the other? And our profession doesn't even talk about it. I think I'm the only person out there that talks about it besides yourself and the people that I've worked and trained with, because it is such a relevant thing of how the horse goes. If a horse is hollow and bulged like this, then your biomechanics of how you land on your feet is completely altered, right? And it affects everything. Trying to take a jump on the left lead, good luck, because your horse is bulged that way, and you got to use so much left leg plus left rein just to get the horse to bend to get to a big jump. I mean, same thing with spinning.
It seems just repetitive, and I know that's really what we're trying to focus our research on. Is when we go to AEP, it's like, okay, there's a whole lecture on SI injections and ultrasound guided SI injections, and it's like, okay, yes, that needs to be there for new practitioners, I guess, right? But like the rest of us who have gone more than one conference, I don't need that same spiel again. But they're not talking about how to inject a lumbosacral. They're not talking about how to get to the hip axials. They're not talking about calcification in neck muscles. I thought the other day we have got to write a white paper on calcification in neck muscles. I diagnose it all the time.
Exactly.
Horses, they all they don't want to separate. They hold their neck to one way and they only swing that way. There's a repetitive pattern, and I go to take films, and you don't just take the cervical films that come up a little bit and boom, all scarring within the serratus, all this calcification. The other day, this whole horse had all this soft tissue calcification over its withers. It probably flipped over at some point. It tore all those muscles. There's no papers on any of that. But you know what I can do? I can shockwave it and relieve a lot of that pain and break up the scar tissue over time and get improvements. But none of these things do we talk about. Before we came on, we were trying to find brachial plexus things because I had read in a book, and I'm going to remember which book it was at some point. But I went to look up, I see a fair amount of cases with brachial plexus injuries from mild to severe. And I had one, and it was biting itself, and I'm like, I'm going to re-pull up the pattern. I'm going to try and backtrack and figure out which nerve this is following neurology. And so I go to Equine Neurology. This will be my favorite. This is like a Bible of equine neurology. Thanks, Martin Freer and Steve Reed. And I'm like, okay, I'm going to go to the index, and I'm going to look for brachial plexus, because like it's a huge deal in a horse or a human or anything else. It's not even in the index.
No, they don't have them.
Go to brachial plexus and find it. So then I search and I search and I search. and I find disorders of peripheral nervous system. I'm like, surely it's in there. And it has a 1, 2, 3, and 4 sentences in an entire
Neurology
500
book.
page book on neurology. Brachial
Right.
plexus injuries get 4 sentences. The other book that it's in, I think it was 5 or 6 sentences, and it essentially described that the anatomy around the brachial plexus is not very stable. It is all soft tissue. It is at huge risk for injury because there's no protection of the brachial plexus, but we don't really think horses get it, and there's no information about it. And
I
I'm
know.
like, the book was like 1,000 pages on everything under the sun. And I'm like, I got 6 sentences on a massive nerve bundle that is this big, sandwiched between 2 bones and soft tissue, hopefully protecting it.
Yeah.
They get injuries there all the time.
All the time. I know. It's especially jumping horses.
So like if you're a veterinarian and you go, okay, this horse, the owner watched it, it's splayed out, it's now been very lame on its right front. It may or may not have some degree of muscle atrophy. It may or may not be biting itself, but it's very lame, and you blocked it out and it doesn't block out. There's no limb swelling. And so then you're like, okay, and you go to try and read it and there's nothing.
No.
Even diagnose it, let alone figure it out. And I think that's the big thing, is to be able to pump out more research. We have to be able to pump out white papers, because you and I see so many things that could be vital to people, wouldn't have access to you or I, or maybe couldn't deal with the full treatment level, but like we could talk to their veterinarians and give them some avenues to go down, because this happens all the time.
All the time. Remember, okay, so remember, this is what got you going whenever you and I first met. And I told you, I mentioned this before in the first podcast with us, is you have to do necropsies, and you have to do methyl blue, and you have to prove to yourself and also the fact that I could just be talking smack, right? That you can treat the brachial plexus. And if you do it the way that I trained you, it's accurate, right? So I know the first necropsy I remember you doing, you didn't send me pictures.
I warned her ahead of time, you will get no pictures if I sucked. You will get pictures if I was spot on.
Yeah. And so she did another necropsy, and then she sends me this beautiful picture of the huge brachial plexus in the methyl blue, all there, right? And I was like, ta-da, right? It is a big thing. Like if you look in books for lumbosacral, it's not that lumbosacral plexus, it's not there. So I was doing some research, and
peripheral neuropathies, in case you're worried, in here gets 8 sentences. 8 sentences
for peripheral neuropathies. So
anything nerve related outside of the spinal cord and brain, for those owners listening. And so when people go, I think my horse is ataxic, but its EPM and its Lyme was negative and blah, blah, blah. They're like, oh no, because you only got 8 sentences on what else could go wrong.
If I turned my computer around and I showed you people my books on my bookshelf, I'm looking at this book, it's peripheral neuropathy, and then pain management, and then all of my neurology books are human.
Neuropathy one there too, yeah. Because I had a full human ones.
Right. And remember, I send you pictures like this, my Christmas present, right? I would send Kate these books, nerves and nerve injuries. I'm just looking at everything, functional neural medicine. Like all of these books are human. Do you know why? Because there is nothing in the veterinary medicine world.
I think that started when I bought my first one. I went, and I think I was calling you because I started drawing everything, right? Because I'm an audio learner, so I can listen to it, and then to really know that I know it, I always make diagrams or I draw out outlines. And I was like, okay, I'm going to write a very basic drawing of the nervous system. This to this, these plexus goes there, blah, blah. And I searched for hours.
Yeah, I remember you calling me. Yeah.
I told him, like, where can I find this, right? Like, where exactly is my lumbosacral? Where are all those nerve roots going out? Where is my brachial plexus? Where are the channel blockers, right? If it's from here to here, it's this. If it's from here to here, they don't exist.
Yeah.
A lot of the times it comes back to imaging, our inability to image horses properly. I mean, nerve pain in humans is even very hard to image. It goes to basic
Right.
clinical symptoms a lot, right? That human medicine has acknowledged you could have severe nerve pain and not have an answer to why. And the notion that we don't even give horses that credit. The CSU paper, while some levels, at least said
Yeah.
horses can suffer from nerve pain.
Right.
Oh, ganglionitis is a thing. Thank goodness. I've been treating it now for a while and they
Right.
get better. Shivers is a great example. Even if the physical biomechanics of shivers don't change a lot at first, their neurology improve. They are calm. They get fat. They sleep. They finally have relief from the nerve pain. And so the avenue we need to keep pushing on. And that is the avenue that practitioners out there in the trenches should be sitting in a group meeting on. You should be getting
Right.
the top 10 or 12 people together and going, okay, well, how are you treating it? What are you treating it? And then we need to share that, because you and I treat lumbosacral, top sports medicine vets treat lumbosacral all the time.
Mm-hmm.
Practitioner doesn't even realize that gets done.
Well, because it goes back to the same thing, like what I said from the beginning. AAP is coming up in December. I'm going, you're going only to get CE credits. And I have to present a 30-minute thing, right? What a waste of my time and money. Because they're huge every year. Here's a prime example. Here's my, of course, you know me, I always get broken. I buy broken cutting horses. So here's a picture. If you guys can see this, let me
look at his scapula.
Yep. But okay, what else this is never talked about. This is what we're also missing is, let me zoom into the problem. Look at that sweat pattern. And where is that sweat pattern?
He's grown. Oh, well, make sure you send that. But the sweat patterns are always cool.
So the sweat pattern on this horse, especially after I work him, is something that I look at as a veterinarian all the time. The best one is this, his hamstrings. So look at his hamstrings, look at the sweat patterns. So the sweat pattern on his side is right where the D is on the saddle. And every time I brush him there or curry him there or work on him myofascially or, just myofascial muscle, he turns and wants to bite me. And it goes back to the same thing. We are missing all of this. We're missing all of these things. So Kate brought up about the book thing. So I called Kate and I said, or you called me. I was here in the office. And I said, do you realize, what was I looking? Oh, sternum. Remember, yeah. I was looking for, because of for the seminar that's coming up here that I'm teaching. So I tell her, I'm like, okay, I'm looking in all my lameness books, which I have probably 15. Okay, so here's one of the lameness books. And it only there's nothing on a sternum or ribs. They don't have those. They don't have them. There. So of the back, on the back, it's one chapter, says the back. There are 38 pages. 560 pages in this book. And there are 38 pages on the back. Okay. So then I go, okay, well, I'm going to go to the next one. This one. And I look through here and on axial skeleton, there are 14 pages. And there are 442 pages in this book. So then I go, I'm sorry, Sue, I'm going to pick on you. Then I go to the Bible. This is the Bible, people. On the axial skeleton, there are 52 pages. On the foot, there are 104 pages. On the front limbs, there are 87 pages. On the hind limbs, there are 88 pages, which means there are 279 pages on the foot, front limb, and hind limb. That's distal limb. There are only 52 pages on axial skeleton. And there's one teeny, kind of like brachial plexus, there's one teeny weeny little paragraph of 2 sentences on the sternum. in this Bible of, oh man, how many pages is in here? Like it is over 1,000, almost 1,400 pages. So we, as a profession, we, as a general, we are missing. Why are we not solving these lameness issues? Right? It's because it's not here. Mm-hmm. All of things that people have to go to, it's not there, which forces me to buy all these human books. And I think in dogs, like I do tons of things with dogs too. You know, I have a ton of dog books, but I also Google a lot of things with dogs.
Yeah.
But we're missing it. Your horse is lame, still lame, retired sometimes, because of the fact that there is no place for us veterinarians to go. And Kate and I only have 3 letters behind our names. DVM, Doctor of Veterinary Medicine. And the problem that we find and what our goal is to do research, to actually give people. I spent my whole retirement savings on the Shivers research, did it the academic way. These people not only ostracized me, but censored me and tried to come after me. The world is not fair in the ability to get information out there. And Kate and I talk about this all the time. Why is it the fact that I spend my budget per year to buy published articles is $5,000. I spend $5,000 every single year buying published research articles online. And why doesn't AEP, like why doesn't the veterinary profession have a place where we all subscribe to something, $50 a year? You have we only have 3,400 equine vets in America, so that wouldn't pay for it. But all the veterinarians, right? So we can, if we need a research article, we don't have to pay for it. Or people do open access so that we have access to it. But part of the problem, right, Kate, is we don't have access to so much of this stuff. And also it's the fact that we want to do research. And the only way you get notarized many times for research is you have to be board certified or in a research institution like that, right? So it is a huge problem that we are trying to change, because the fact is every single one of us, we're all missing lameness issues with your horses. And that goes back to Sue Dyson with the riding ethogram. I think Sue did an amazing thing there, but it starts like what I showed with the picture of my new cutting horse. He's a 5-year-old and he is broken. Like he is so broken. Ugh. How did they get so broken as a 4 and 5-year-old? He went to the fraternity as a 3-year-old. That's why he's so broken. Anyways, what I'm trying to say is it starts from the moment they're in their stalls, right, Kate? It is observing them in their stalls. It is observing them when you groom them. It is observing them when you pick up their limbs. It is all this information that nobody is paying attention to. The farriers, what they have difficulty with when the farrier complains about the right hind leg. The reason why it's difficult for the horse on the right hind leg is because there's something wrong. And we are missing all this, right? We are totally missing. The veterinary profession is not paying attention to this. And also it's the awareness. The owners recognize it. The grooms recognize it, but people don't listen to the grooms or ask them questions many times, right? And so all this very, very subtle stuff is ignored. And that's the beginning of all this. Like, to me, that's where we all need to start. And the way we're going to start, and I'm just telling you, I'm putting this out there. I'm working on it right now. I'm working on this. I called Kate. I'm like, this woke me up at 2:30 in the morning. So it's really important. This is how I know I need to do something. Like when something wakes me up, and literally it is 2:33. I don't know why those numbers are important, but I wake up at 2:33 a.m. It is a specific number. And when I wake up and I look at my watch and it says 2:33, I'm like, I have to do something. I have to really do something. If it wakes me up at 3:31, which is another time, no, I don't have to. I just have to pay attention. Sue did the riding ethogram. I think that is exceptional, but we need to do a standing, what did I put? Standing, grooming, tacking, and farrier ethogram. So I'm working on that right now. And it's going to be a survey that is going to, Kate's going to put it on Rexos. I'm going to put it on my website. And I want you to go, I'll let you know when it's up. We're going to do another podcast in just a couple of weeks when everybody is here at my farm and my clinic to do the girthiness seminar, because I think that is another thing. Girthiness is the same thing. We're all missing the causes. Nobody has a solution to the problem except saddle fit. And how many people have had this out? Yeah, or ulcers, right? How many people have had the saddle fitter out 1,000 times? How many times have people spent thousands of dollars with ulcer guard, and every time you scope that horse, it has ulcers again? And I'm telling you the answer. You will alleviate the ulcers once you treat the pain. And it goes back to the very beginning of what I said in this podcast. When you Google what is the most common cause of lameness in horses, it comes up pain. That wasn't the same like 3 years ago, even 2 years ago. So we need to do an ethogram so that we can publish this information and the numbers so that we can make people aware. To me, it goes back to the beginning of what we talked about, right, Kate, is awareness and recognizing all these things and seeing the patterns. Like when you groom your horse, like my little cutting horse that is broken as a 5-year-old, coming 5-year-old, when I curry or rub every night around his rib cage and where the pommel of the saddle sits behind the scapula, he wants to turn and bite me. And I've shockwaved him. He's due for a shockwave this weekend. But I have treated that horse 4 times, injection wise, and he's looking better, but oh my God, do they fall apart, right? Wow. And they fall apart. What people don't realize, and this is something we talked before, and you'll agree with this, Kate, sometimes they just fall apart and they are so lame. Like they are so dysfunctional because they've just been so tight. I mean, just so tight. And the shoulder, he's got a horrific shoulder girdle issue. And it's going to take him a while. I've only had him for a couple months, but I mean, I'm looking at another 6 months before I can send him off to the trainer. Like I bought a horse broken and I got 8 months to spend, if I was a private owner, like where I wasn't a veterinarian, it would cost, I mean, it's a lot of money. I think about all the treatments, right? It's a lot of money. It can be a lot of money and time. I mean, I can accelerate the process, but it's still, he's got to get strong as he gets strong. But I do think that we need this ethogram, and Kate will put it on her website. I'll put it on mine so that you guys can go there and fill it out. Kate, is there anything else you want to bring up?
I'll try and update stuff too. It made me think about that. I took a couple really great videos of lumbosacral versus SI and a dissection, and I'll put those up on our Patreon page. So we switched from putting necropsy information on Facebook because it's just too much and there's too much misinformation out there for necropsies on Facebook, and just misinformation totally in general. But so we have a Rexos Patreon page, so it will go on there, because like all things, doing all this research is expensive. And so it's like a small membership fee, but then you could have access to those videos. I'll make sure to go up and post them. It just, how does that actually move and what does it actually look like? Because until you start to see it, it's hard to totally imagine. So that's it from me. I'll make sure to get those up. I have a couple good ones on back pain and where does that originate and what does that actually look like on there too. So we'll get that squared away. Other than that, that's about all I got for you.
Hey, I think that our next podcast actually needs to be, because I get emails all the time from people to do the surgery or non-surgery on kissing spine horses. And I know that's a passion of yours.
Yeah.
Kate loves the kissing spine stuff.
Yeah.
I
don't really care. It's about how I feel about shivers. I'm kind of like, okay, that's your thing. Like I like it and I don't mind treating it, but I'm like, okay.
Yeah,
I
but
love
shivers,
spine
I'm so done
it's
with
so angry.
I'm so done with shivers and string halt.
Yeah.
Like I was done 10 years ago, like with shivers and string halt. I'm still done with it. I just want
so that would
somebody
be
to
good. We could do one on
take it off my page. Like
what
I
is
need
surgery.
I need everything dumped off my page so I can go fishing more. But so that I think that's what we should do next time, because you have tons of good radiographs of before and after that you can.
Yeah, I've got good radiographs of before and after. And I took one horse that we had on knee necropsy and went through the different surgeries and what does that look like and how does that affect soft tissue and stuff like that. And I think we could add it into the YouTube too. I think it would be okay for YouTube without getting blocked, but we'll look into that. And if we can't put them on there, we can link it.
Because you can share your screen and we can just show the x-ray, and let people, see the difference. And it's clinical findings. It's not, but I think we need to talk about this because so many people are deciding whether they're going to have the surgery. And I think it's understanding the pattern in the clinical picture before you make that decision.
Yep.
And the other alternative ways you can go about it before you decide to do surgery. That I think is very important. So thanks again. Glad you're
absolutely
here. And as always, I want to give a huge grateful thanks to Rebecca Shavlik and the Shavlik Family Foundation for supporting me in the shivers research. And thanks to all my clients. I've learned so much from all your horses. So thanks for listening. More importantly, thanks to all the horses who have been my greatest teachers. Any feedback, go to DeClueEquine.com. Let me know. So goodbye. Let's start listening to the horses' stories so that they have a voice.